What if one accident, one forgotten dish, and one curious mind could save millions of lives? For centuries, a simple cut, a tooth infection, or a dirty wound could become a death sentence. Then, almost by chance, medicine changed forever. But the strange part is this: the discovery was not immediately obvious. In fact, the world nearly missed it. Today, we take antibiotics for granted. A sore throat, an infected wound, a risky surgery. Doctors fight infection with tools that once did not exist. Before that, even routine operations were terrifying. The real danger was often not the surgery itself, but what came after it. Infection spread fast, and medicine had few answers. To understand why penicillin was so important, you have to imagine the world before it. Hospitals had no miracle drug waiting on the shelf. A small infection could turn deadly. Childbirth was more dangerous. Open wounds from accidents, war, or labor could become fatal. Doctors could clean, bandage, and hope. That was often all they had. Then came Alexander Fleming. In 1928, Fleming was working in a London laboratory, studying bacteria. He was not searching for a world-changing cure. He was simply doing research like many scientists do. Then he returned from a holiday and noticed something odd. A mold had grown on one of his Petri dishes. Around that mold, the bacteria had died. That moment should have sounded like a whisper. Instead, it became a thunderclap in medical history. Fleming realized the mold was producing something that killed bacteria. He named the substance penicillin. But here is the surprising part. Discovering it was only the beginning. Fleming could see its potential, but turning that idea into a real medicine was far harder than anyone expected. Why? Because penicillin was difficult to isolate, hard to produce in useful amounts, and not yet ready to save patients. For years, the discovery sat there like a locked door with no key. The world knew something important had been found, but not yet how to use it. That key came later. In the late 1930s and early 1940s, a team of researchers at Oxford, including Howard Florey and Ernst Boris Chain, took Fleming's forgotten discovery seriously. They worked to turn penicillin from an interesting laboratory result into a usable drug. This was not simple. They needed enough of it to test on animals, then humans, and then, hopefully, entire hospitals. Supplies were tiny. Every drop mattered. The early results were astonishing. Patients who might have died from infection began to recover. Wounds that once would have worsened started to heal. Doctors finally had a weapon that did not just treat symptoms, but attacked the bacteria causing the disease. For the first time, medicine had a powerful answer to many common infections. And then war pushed the discovery into the spotlight. During World War II, infections killed huge numbers of wounded soldiers. A bullet wound was not always the main threat. The real enemy was often the infection that followed. Penicillin offered hope on a scale the world desperately needed. Production increased rapidly, and by the end of the war, it was helping save countless lives. But why did penicillin work so well? The answer is both simple and remarkable. Penicillin attacks bacteria in a way that stops them from building their cell walls properly. Without those walls, the bacteria cannot survive. Human cells do not have the same structure, which is why penicillin could fight infection without harming the body in the same way. That was a major breakthrough in medicine. Still, there is one more layer to this story. Penicillin did more than save people from infection. It changed the entire future of medicine. Surgeons could attempt more complex operations with far less fear of deadly infection. Doctors could treat illnesses that once spread unchecked. Hospitals became safer. The survival rate after injury improved dramatically. A discovery made in a messy lab changed the way humanity understood disease itself. And maybe that is the most surprising part of all. This wasn't a planned invention from a giant company or a perfect experiment designed from the start. It was a discovery that required luck, observation, persistence, and teamwork. Fleming saw something unusual. Others recognized its meaning. And after years of effort, the world finally learned how to use it. So the next time you hear the word penicillin, remember what it really represents. It is not just a drug. It is the moment medicine stepped into a new age. It is the reason millions of people survived infections that once would have been fatal. It is the turning point that made modern surgery safer and changed the future of treatment forever. One mold, one observation, one discovery that changed history. And that is why penicillin remains one of the greatest breakthroughs ever made in medicine.